Well, hello. Hi. My name is Jody Scholes. I'm your instructor for the MBLEx review course. How are you guys today? Yay. I think you can see everyone. You sure can. Good. So today's class is a specific MBLEx review, so preparation for the Massage and Bodywork licensing exam. This is specifically for massage school graduates, and if you're really close to graduating, or if you know that you'll be graduating in the next 12 weeks, this is a review of kinesiology of the coxal joint. Do you remember the coxal joint? It is actually the hip joint. It is the scientific name of the hip joint. And so today our class is going to go down in 3 rounds. Those 3 rounds are one, a test-taking strategy, because we like to frame in not only what to study, but how to study. Then we'll do some learning together, go over the anatomy and the movement at the coxal joint, at the hip joint. And then at the end of class, we've got questions. Third part of class is dissecting questions. So it's applying what we've just learned to MBLEx-like questions. Now, I want to mention that the questions you see here in class, the questions you see on the practice exam, are not the questions, not the exact questions that you're going to get on the MBLEx. They are not. No. And that is because no one knows what questions are going on the MBLEx. That's why I say they're MBLEx-like questions. So they're structured like, and you, depending on what app you're using, you may find this language a little challenging. But let's get rolling with our test-taking strategy for today. And today, I am going to take you back. I'm going to take you back to the day that you enrolled in massage school. hmm Think about it. Think about the day you were signed up. Were you absolutely like petrified because you weren't sure how you were going to afford it? That was me. Um, did you know that this was something you were going to do? You just knew, like you kind of knew for a long time, but you didn't do anything about it right away. So you're signing up for massage school. I'd like you to remember the good parts of that, the excitement about going to class. Oh my gosh, can't wait to hear your stories on this. Um, you're back in that thought pattern. While it's like, wow, how am I going to learn all of this? Wow, when am I ever going to feel comfortable, doing a routine, doing a 1 hour massage? Remember that time in school where you went from, oh my gosh, how am I going to fill an hour? To, oh my gosh, how am I going to get done in an hour? Right? Yeah. I'd like you to connect back to that feeling of being in massage school, excited, looking forward, learning new stuff. Because in that moment, you remembered what you were here to do and who you were here to be. Look, massage therapy is a very unique profession. It's very unique because not everyone is called to be a massage therapist. And not everyone chooses this profession, right? So guess what? You didn't really choose to be a massage therapist. It chose you. You got it, Raven. You got it. It chose you. And so what that tells me, and why I am consistently enthusiastic about your ability to pass the MBLEx, is because this is bigger than you. This is your destiny. This is like what you're called to do. It's who you're called to be. And so you can't avoid it. I mean, you're here, you're doing your part, just like showing up, going to massage school. You're doing your part. But I want to remind you that this is destined to be for you to pass this test. Might take more than once. Who cares? That's just logistics. You're doing your part in preparing because you will pass this test and you will practice as a licensed massage therapist. Because not only is it a dream, it's a destiny. So you are following, you're on the path, you guys. If sometimes you wonder, am I on my path? Yeah, you are. I'm here to remind you. Yeah. And thank you. Thank you for listening to the song of your heart. Thank you for listening when it resonated. Like, oh, this is a profession. I could do this. Yeah, here we are. So you ready to do a little learning? I'll stretch you today. Yep, gonna stretch you today. All right, here you are, ready to study. Today, welcome to the MBLEx Prep for massage school graduates. We've been doing this since 2015, and we are doing this for you. Yes, for all of you who are ready to pass the MBLEx. Today, we are focused on the hip joint and the pelvic girdle. This lesson is specifically about the kinesiology, the movement at the hip joint. And we do classes on the movement of the shoulder joint. We do classes on the movement of the hand and wrist, the knee, the ankle. Today we're diving deep on the hip joint. And so to do that, we're going to learn the anatomy. And so you'll see here that we'll talk about the anatomy of the pelvic girdle and the actual hip joint. So we'll talk about bones, bony landmarks, and other interesting landscape that is a part of the pelvic girdle. And then we'll move into talking about the movements that happen specifically at the hip joint. Yes. So that ball and socket joint, and we're going to be looking at three specific movements, well, three categories. We're going to look at flexion and extension, adduction and abduction, and then medial and lateral rotation. You're going to have these down by the time we finish class. Then, to add to the fun, not only are we going to look at the movement, but we're going to look at which muscles create that movement. All about the hip today. Let's revisit the skeleton. Let's revisit where we're going. We're going to this pelvic girdle. And it's a great reminder that we have in the skeletal system, we have an appendicular skeleton and we have an axial skeleton. And so the appendicular is outside, like your appendix. You can live with your appendix outside your body. So the appendicular skeleton is all of our limbs. Our axial skeleton is our skull, our vertebral column, and our rib cage. So the cranium, the spine, and the rib cage, the thorax. That's all that's in the axial skeleton. So you'll see in this image, one is blue, one is yellow, right? Is the pelvic girdle blue or yellow? Mm-hmm. It's blue. Yeah, exactly. It is a part of the appendicular skeleton. Isn't that crazy? You would have thought, right? Yeah, you would have thought that it was a part of the axial skeleton. It's like because it's hips, right? It's foundation, but it is not. It is part of the appendicular skeleton. So meet the pelvic girdle. Here we are. So this pelvic girdle is made up of, so you'll see the lines of the bones here. This is the anterior view. So here's our spine, the very bottom of our rib cage. And we're going to be going over the names of these bones that make up the hip girdle. Here's the sacrum. The sacrum is technically part of the spine, but look, we've got an ilium here, right? That bone is called the ilium, or you may recognize it by the iliac crest. It's the ilium, the bone. And we'll talk a little bit more about that. But this is your sacrum. Excuse me, this is your pelvic girdle. So three bones in particular are your pelvic girdle. Let's take a look. What is the function of this pelvic girdle? Pause here, please. Let's look at a distinction that we're making as far as lower body. We are in the lower body. Good. Four parts of that lower body. The hip bones, the femurs, the legs between like the knee and the above the foot, and then the ankle and foot. So these are segments you can study independently. We have lots of classes that specifically work with just these segments of the lower body, like today, that we're talking about the pelvic girdle. And so the main function of the pelvic girdle is to support the weight of the upper body and to move in gravity. So to adapt and to balance in gravity. So I loved the analogy of gravity I heard the other day. And it was that, the law of gravity works all the time. So when you take a book and you drop it to the floor, the law of gravity snags that book, right? That book doesn't drop to the floor because the universe is angry with you. It doesn't drop to the floor because the universe is happy with you. It is a law, a physical law, the law of gravity. And so that how we show up. So our pelvic girdle helps us to move through gravity, keeping our balance. And of course, the muscles are there to balance. Now, you may see a word come down here to the bottom of the screen, please, and that is locomotion. And I saw that in a few different texts, and I wanted to point it out for all of our English as a second language, and even for our English as a first language, because keeping our balance in gravity and locomotion. Locomotion means movement or moving from one place to another. Now, you might recognize the word locomotion in a different context. What about trains? So, locomotion is simply moving from one place to another. Locomotive is actually another word for train. Yeah, so this is a train. It can also be called a locomotive. And so motion, locomotion, if you see that on the MBLEx, is movement. Yep. Yeah, and there's a song that if we could play it, I'll link the song, the movement about locomotion in our notes for when I replay the class. All right, but this point is basically the main function of the pelvic girdle. It's to support the weight of the upper body, and it's a distribution point of that weight to your two legs, lower legs, ankles, and feet. So to adapt and balance in gravity and movement. So let's have some fun, shall we? The three main bones of the pelvic girdle. The pelvic girdle is also called the os coxae. That's where we get the coxal joint. The coxal joint. So these three bones together make up the os coxae. So if you see this word on the MBLEx, they are talking about the pelvic girdle in whole, all three bones. So let's take a peek at these three bones. All right, I want to talk about the purple one. So the purple one here is the ilium. And I mentioned it earlier, and that is we have an ilium at the top round part of this purple bone on both sides. It is called the iliac crest. All right, so ilium I. And I started to talk about the sacrum, right? And how the sacrum is actually part of the spine. So, fun fact. However, a very important part of your massage therapy is going to be assessing or palpating, touching the SI joint. So the SI joint is the sacroiliac joint, sacrum and ilium. Yeah, right here where the purple meets the white, the SI joint. Now, of course, that is going to be done while your client is in prone position, so they're face down. You're going to be finding that iliac crest. Well, first you're going to drape, right? You're going to drape above the gluteal cleft, so no crack of the bum is showing. Secure drape, okay? Securely drape, tuck it under. Some people like to put a hand on top, but that can be a little chilly. But you're going to expose just the top of that iliac crest. And then either on the skin or through the sheet, depending on your client's body, you're going to palpate that SI joint. So the sacrum, the sacrum right here is the white, and the SI joint is where the ilium meets the sacrum. There are just a ton of ligaments there, and it will solve so many of your client's lower back problems to understand that SI joint. Okay, wanted to point that out while we're here looking at these three main bones. We're going to see this again. I want to mention, see how this says os coxae? It is not the coccyx. Remember the tailbone? That's a part of the sacrum, a part of the spine, and it's the coccyx, right? And so let's make sure that we know the difference between the coxal joint, the coccyx, and the os coxae. I know a lot of words that look similar, but that's why you're here. That's why we're pointing them out. All right, let's do this. So here are the three joints. Ooh, nice picture of that SI joint again. So the os coxae, and you're getting super clear on that sacroiliac SI joint. That sacroiliac joint, lovely, lovely, lovely place to work. Pointing out again, this is the posterior view, so you can see it nice and clearly, that part of that tailbone. And you can also see that SI joint, right? Where that sacrum meets the ilium. It's usually a little bit smoother like that. This is the anterior view in the upper left-hand corner, and this is the posterior view. I wanted to give you a picture of that coccyx as a part of the vertebral column. Good. Apparently, I really wanted to point out the SI joint because it keeps coming up. But in this, we can see here our something that joins these two bones together. I'm going to focus on this lower right-hand corner for a moment and show you the ilium here in the bone color. And then in the front, you've heard of your pubic bones, right? So this is in the red. And then our ischium. So the word ilium and the word ischium, they're kind of similar, right? S is in the ischium. Ischium is at the bottom. And remember, at our bottom are also our sit bones. So if you look at these two little loops here down at the bottom, that is technically these two little loops that are purple. The purple, and that is our ischium. So S for ischium, S for sit bones. Our sit bones are a part of our ischium. That might come up on your MBLEx. Now, in the front of this pubic bones, the pubic is something called the pubic symphysis. right here. We're going to see that again just a little bit later, but I wanted to start to point it out to you because you'll hear it's a cartilaginous joint. It's slightly movable. We'll say that again, but this is a beautiful picture, so I wanted to show it to you here. So again, ilium at the top, pubic in the front, ischium in the back. Anterior and posterior view. And we're here in the pelvis. And you can see these sit bones. Can you find your own sit bones? If you move the fatty part, or the fleshy, I should say the fleshy part of your butt, you'll feel two little bony points that you're sitting on. So sit up straight and tall. Find those sit bones. They're also called your ischial tuberosity. We'll see that again in a moment. But ischium, sit bones. S for ischium, S for sit bones. It's purple. In the front here, you see again that those pubic bones. There's two sides. The pubic symphysis. And again, that bone colored is that ilium. Here's the posterior view, as you see here. So that would make this the posterior iliac crest, and this the anterior iliac crest. This is also known as the anterior iliac spine. And we'll see that again momentarily, just putting two and two together for you. Let's take one step at a time. All right, there are two parts of this bony, this coxae that I wanted to point out. There's a few things. So the foramen, and in this picture you can see it nice and clear, this hole, see it here too, the hole, that is a foramen. It is called your obturator foramen. And the way I remember it is if I worked as a foreman, I may be supervising digging holes. It looks like the word foreman, the foreman on a construction crew, the foreman, right? So the obturator foramen is actually how you pronounce that. So these two holes. And here again is that pubic symphysis. Right here. It is a semi-movable joint. It is known as amphiarthrotic. So I think of amphibian, amphiarthrotic, and it is also called cartilaginous. Now, let's pause here for a second. Is this a freely movable joint? Is the pubic symphysis freely movable? Nope. It's semi-movable. Remember, we have three categories of joints. Not movable, semi-movable, and freely movable. So when I say not movable, it's immobile. And immobile joints, it doesn't move. The sutures in our skull. Semi-movable are these cartilaginous joints. And that's a beautiful example in the pubic symphysis. The joints that we all think about are our synovial joints. Those are the freely movable ones. Fingers, wrist, elbow, shoulders, hip, neck. Yeah, those are all synovial joints. They're lubricated with synovial fluid. They're freely movable. That's a whole nother category. But in this case, we're looking at the pubic symphysis, and that is only slightly movable, and it is considered cartilaginous. If you saw that word, what would you think? Cartilage. Right. Good. Another image for you, because we're moving away from, so we're going to start to now talk about the hip joint. But to understand the hip joint, you really need to understand the os coxae. You need to understand the pelvic girdle, because that's the home. That's where that joint inserts into. That's where that bone, the head of the femur inserts into. That's where we're going next. Here we go. So you can see here the hip joint, the femur, ischium, S for sit bones, Good. The iliac crest. Nice. SI joint. And all together, this os coxae is considered the pelvic basin. There's another name for it. As we get into the hip joint, so what is it? Well, we're looking at the anterior pelvis here. So a view from the front. We've got the socket that is a part of the os coxae. The pelvic girdle has that socket, and that socket is called the acetabulum. Yeah. And then we've got the head of the femur. Bonus points if you can tell me, is that the proximal head or the distal head of the femur? And put it in the chat. Give them a thumbs up, Tara, if they get it right. So I'll tell you in a minute out loud. So you can put it in the chat. Is this the proximal or the distal head of the femur? And so you can see here, this is the thigh bone. This is actually the long bone, the shaft, if you will, of the femur. So these pieces make up the hip joint. So let me see. Oh, good. John Robert, Alicia, good. Shireen, yes. Tracy, Raven, nice, nice, nice. And Maria, yup, good. Proximal head, right? It's the upper head, right? So the higher part is the proximal, the lower part is the distal. So, and those are for our long bones. So our humerus, radius, ulna, femur, tibia, fibula, they all have a proximal head. They all have a distal head. So if you get that question, if you get that clue on the MBLEx, you'll know where you are on the bone, whether you're up at the top or at the bottom. Good. So, interesting facts about the femur. And it's the strongest bone in the body. You may be asked that on the MBLEx. The femur is the strongest bone in the body. And it's the attachment point for about 22 muscles. Yeah. There's a ligament that also sometimes comes up, and that's the iliofemoral ligament. Now, we talk about different ligaments at different times. Ligaments attach bones to bones. Tendons connect muscles to bones. So in this case, I'm talking about the head of the femur, and I'm talking about the acetabulum. And so this is a ligament attaching a bone to a bone. So the femur to the hip is known as the iliofemoral ligament, and it's the strongest ligament in the body. Yeah. So now if you never ever knew, like you'd never heard this information, but you've studied medical terminology, haven't you? Yes. And so you can dissect this word. You'll see iliofemoral. So you may not get ilio right away, but you'll get femur. You see femur in there, right? That word, femoral. So you know you're having something to do with the femur. And ILI, ilium. Medical terminology, my friends. Helps you break down these words that maybe you've never heard about. Okay. So this is an anterior view. I'll reference this image here. So we have the head of the femur going into the acetabulum. Here's the iliofemoral ligament. And you see how this head of the femur, you see it here too, how it bumps out. See how that bumps out? And for ladies, this is going to be the widest part of your hips. So if you've ever taken a hip measurement, it's right at this bony landmark out here where we take our hip measurement. And this is called the greater trochanter. And I'm going to point out here too, this little bump on the inside is the lesser trochanter. So you got lesser, greater. See it nice and clear here. Greater trochanter. Should really be touching that one little part right there. And then the lesser trochanter. Lovely. Let's get into some movement, shall we? Yes. So some movement. And so today we are going to be talking about different movements in the hip joint. Those movements we're going to be talking about, the coxal joint, right? Those are internal and external rotation, adduction and abduction, and flexion and extension. So these might sound familiar. I hope they do. Let's start with an easy one. Let's go flexion and extension, shall we? And here we go. Flexion and extension. Yes. So flexion at the hip joint. It is actually the movement that initiates walking. Yeah. So if we are standing, like my friend with the mullet here, in anatomical position, we're seeing this from the lateral view, the side view. And this red line represents the femur. The red line represents that femur. This can represent the spine, or this can represent also the os coxae, the pelvic girdle. Yes. And so flexion moves that femur forward. Yes. Moves that femur forward. I'm going to say it. We're not going to cover it today, but it's in the sagittal plane. Remember, if you are sitting on a saddle, sagittal plane, that's a lesson for another day. If you don't know your planes, go to navigating the body. We cover them in depth. But that femur moves into the front of you, in front of you. So that's the sagittal plane, and it's moving ahead. This is called flexion. So let's look at more images of flexion. Oh, it'll be good to know that the muscles, we'll cover a little bit of the muscles here right now. Sure. Psoas. Yay. Okay, this isn't just the psoas though. This is the ilipsoas. So when it's the ilipsoas, it's the iliacus and the psoas together. It's a combo package. So the primary hip flexor, the one that initiates walking is and running for that matter, is the ilipsoas. It's a beautiful picture here, right? This one on the inside here is the iliac crest. And on the inside of the iliac crest is the iliacus. Yeah. So the iliacus and then the psoas major. And we're seeing that here run down. And so it starts in the lumbar vertebrae, comes through the middle of the body, through the thorax. And looky. Hmm. You see this is the head of the femur, the proximal head of the femur, the one we just saw with no muscle attachments. And look where that psoas is heading. Hey, looky here. Yup. So the psoas is heading to the lesser trochanter on the inside of the thigh bone, inside of the femur. Let's take another look. We'll take another look at the muscle in a minute. I wanted to put the flexion of the femur into different positions for you because you can flex your femur when you're standing up by taking a step. Over here in the lower left-hand corner in the blue, you can flex your femur by just lifting your upper leg. Also, laying on the ground, flexion of the femur. Yes, so in different spaces. So the primary flexor of whatever angle you're at, any of these three, is the psoas. The primary hip flexor is the psoas. So psoas major and the iliacus. Now the psoas also influences anterior and posterior pelvic tilt and trunk flexion, but we're going to stay focused on flexion at the hip joint today. Here is another lovely picture. Oh, I love this picture so much. Okay, so we saw this one here in the middle, but take a look at the green here in the upper right-hand corner. You can really see that psoas starting at the lumbar vertebrae, coming through the trunk and attaching at the lesser trochanter. And you can see why. See these little arrows that go up? That means when this muscle shortens, that's how it pulls that femur up. So when this muscle, let me do this. I hope I'm not up in the upper right-hand corner. But when that shortens, that brings that femur forward. Yep. So the green, again, is the psoas. The pink here in this upper right-hand corner is the iliacus. And together they make the ilipsoas. So let's take a look at the three parts. And I love this for anatomy's point of view too. So we've got the psoas major in the red, iliacus in the yellow, and the psoas minor is also in there in the purple. And so the major is the one that we're most concerned about. And that originates, it starts technically, here's your last rib, that's T12. Remember that all of the T vertebrae, all the thoracic vertebrae, have ribs. That's how we can tell. Oops, sorry. So here's T12. And your psoas is originating there. Psoas major and minor. Snuck in a little sneak peek of the quadratus lumborum. It's actually over, it's a layer over the psoas. And then that iliacus, very difficult to palpate. The iliacus, in school, you may have learned how to wrap your fingers around the ilium to find it, but it's usually pretty ticklish. Now, it is well within your purview as a licensed massage therapist to do functional assessment tests. Hopefully, you won't be tested on them, but maybe you will. So the one I want you to be most familiar with for the psoas is the Thomas test. So the Thomas test specifically tests the flexibility of the hip flexors, the pliability, the flexibility. And you can see here the Thomas test is pretty simple. You have your client lay down, uh, so supine, with their knees off the table. Now, if they can't do that, that means their psoas and their hip flexors are tight, and their other hip flexors are tight. So that's what this is testing. Are the hip flexors tight? The psoas is considered a hip flexor. We talk so much, right, about the hip flexors. Well, any muscle that moves the femur forward, and there's a few of them, we're going to cover them, that is what we're testing with this particular functional assessment. Yes, so it's called the Thomas test. They lay with their knees, over the edge of your massage table, and then you can help them, if they need it, to bring their knee towards their chest. So take a peek here. In the upper image, where this thigh, this femur, is flush against the table. When they pull the knee towards them, this stays flush. That means they've got some flexibility. That means it's not too tight. The bottom picture, if they pull that knee towards them, and the thigh bone, the femur elevates, it comes up. That is considered positive. Ding, 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 ding. Their hip flexors are tight. Good to know. Going to need to work them in the session. So if your runners are complaining about tight hip flexors, you can take the Thomas test and say, let's see how you're feeling today. Yeah. So this is considered a positive test because there are hip flexors that are tight, specifically the rectus femoris and the sartorius, and of course, the psoas. But I wouldn't recommend you go after the psoas on your first visit with a client. It's a little intense. But sartorius, beautiful, rectus femoris, that front quadricep can get a lot of relief there. And this is the Thomas test. So as I mentioned, the Thomas test assesses the length of the hip flexors. You saw the picture of the contralateral. So it just means the opposite side. What are those other hip flexors? Yeah. So those other hip flexors, we mentioned sartorius. So primary hip flexor is ilipsoas. However, there's other hip flexors that are involved. Ilipsoas, sartorius, rectus femoris, TFL, tensa fasciolata. And then a little bit of the helpers are the pectineus and the adductor longus. So we're going to take a look at these up close. So here's that pectineus, got adductor longus, but let's take a peek at these up close. So rectus femoris is in the front. Nice picture here, this big fatty muscle in the front. It is a part of your quadricep group. The sartorius is also visible here. Tara, if you are able, could you look up and see if the sartorius crosses two joints? I don't think it does, but I want to find out if it does. I think this originates right there at the ASIS. And then the TFL is what I wanted to show you in this image. So the TFL, look at this little hunk, this little hamburger, this little piece of muscle tissue right here. And so the red indicates where the hip joint is, and TFL, the tensor fasciolata, is way up here in the hip. So it's actually above the hip joint and a little bit in front of it. So above and a little to the front. So find it on yourself, will you? So if you're sitting down, it'll be real easy to find. Uh, and so find your hip joint. Go ahead. Let's see if I can do this. Find your hip joint. Yep. And then right above your hip joint, there's a little squishy part. That is TFL. And it goes and it fills in between that squishy part right up until your ASIS, your anterior superior iliac spine. But a lot of people never really palpate their TFL or the TFL on their clients. This is such a yummy place to work. Because look, this TFL, look what it turns into down here. IT band. Yep. IT band. The IT band is not technically a muscle. It is a long tendon, the iliotibial tendon. Ilio and tibial, so you know where it inserts, right? Yep. IT band here. That tibial tubercle. Here's where the patella, the kneecap would be. Yeah. And then you can see we've got our vastus lateralis here. I'm going to just point to this one, this vastus lateralis one right here in front of the IT band. Does go a little bit behind the IT band, but you get into hamstrings when you go posterior to the IT band. So just ignore that little dot. Vastus lateralis, the most lateral of your quadricep muscles. And did we miss any of those? Okay, pectineus, we'll show you again in a minute. But again, just a little recap that the movements of one of the movements of the hip joint is uh, is flexion. We're moving now into oh, this is still flexion. Good. Flexion. Thought I was ahead of myself here. So sartorius, pectineus, TFL, rectus femoris, those are all contributing. But primary mover, you know how I love to ask you to remember the primary mover, and that is the psoas, the ellipsoas. Okay, let's do extension now. So this is the other way that the hip joint can move. So back to mullet man here. This is the hip joint, this little pivot point. Extension, this little red line represents the femur, and the femur is extending. It's moving backwards. And that's the beautiful thing about the shoulder and the hip. Extension is backwards. It's behind you. Yes, so if you're extending at the shoulder joint, you're extending at the hip joint, extending the femur, it moves behind you. Here we go. You sometimes see this at the gym. The movements of extension. So it's initiated by the glute muscle. This is the big glute muscle up here on the right-hand side. And if you can imagine you were doing this movement, in fact, if you're afraid to do so, you can stand up and extend your femur. Move that femur behind you. Feel that glute. Go ahead and grab the extension machine at the gym if you go to the gym. So this red line represents the femur going into extension. Femur in extension. Major mover, glute max. Got a few other movers as well. The hamstrings kick in right there as well. They help. Hamstrings are known for bending the knee, though, right? Flexing the knee. That's what they're really known for. But they're involved. They're definitely involved in extension of the hip. So, what is the role of the extenders or of extension? What does extension do? It moves you forward. So when that leg is back and you push off your toe, you are propelling forward. Also, these muscles help with pelvic stabilization. And so the glute is the most powerful in the muscles we're going to talk about. Next is the hamstrings. But we got a whole bunch. Let me remind you where the hamstrings are. Okay. So got the big glute muscle, but let's look at the hamstrings here. I really like this picture, this one, because you see this semimembranosus, the semitendinosus. Yes, and this one you got the biceps femoris. So 3 hamstrings, just 3. You got semisisters and the biceps femoris. So my little saying is the semisisters are having lunch with their big brother biceps. Biceps femoris, right? Femur, femur, femur. Not biceps brachii. Brachii, brachial plexus. Where would that be? If your biceps brachii, it would not be biceps femoris. It's not the same location. So the semisisters having lunch with their big brother biceps, semitendinosus, semimembranosus, and then big brother bicep. All 3 for you. Now, what's really fun about the hamstrings is that they all have their insertion point, their origin point, so origin and insertion. So their origin, where they start, is at the sit bones. Yeah, ischial tuberosity. Remember that little name from when we were talking about the ischium? Ischium, 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 sit bones. Ischial tuberosity is the scientific name for the sit bones. And so here we go. All of them. So when you touched your sit bones, go ahead and do that again. Move the flesh of your bum out of the way. Find your sit bones. You may feel that they're like maybe a little tight. What's really fun, if you're feeling like, oh, I've got tight hamstrings, go find a tennis ball. Put it on your sit on it on the floor or on a hard chair, like a wooden chair. Put the tennis ball right next to your sit bone. Woo! That's a lovely feeling. Yes. Try it out because it's great coaching to give your clients who have tight hamstrings. Mhm. It's called self-care in between massages. So here we go. Membranosus is going to be M is going to be most medial, sembrimosis, semimembranosus, MMM medial. Semitendinosus is in the middle, MMM medial, and then biceps femoris is actually the most lateral. There you go. And they go 2 different directions. So the hammies go 2 different directions. You'll see down here in the very distal end of the femur. So biceps femoris out to the head of the fibula. It's the most lateral and it heads to the fibula. And membranosus and tendinosus head to the medial condyle of the tibia. So beautiful to work on the lateral and medial aspects of your of the knee because that's where the hamstrings attach. It's also where some of the adductors attach. So beautiful to do those lateral sides, the medial and lateral side of the knee. Just be curious, explore. So biceps femoris heads out to the fibula, fibula, biceps femoris. The semi-sisters head in. Okay, time to change gears. We've done flexion and extension, and now we're moving, we're moving to adduction and abduction next. Should sound kind of familiar, right? Okay, the movements of abduction. I love one of the graduates said, uh, if you're abducted, you're taken away, right? If something is abducted, they're taken away. Abduction is taking away from the midline of the body. So taking away from the midline of the body, that leg moving from neutral, there's a pretend wall here, neutral to out. And this can be seen in different ways. It could be laying on the floor. This is still considered abduction. Midline of the body now is parallel to the floor. And so abduction of the leg, of the femur, femur. Yes, so the femur. And some exercises will have you put a band just above your knees and abduct your leg. Helps to build strong hip muscles. What are those hip muscles that we're looking at? What does this movement? All right, the thigh is being pulled away from the midline of the body. Therefore, it is glute medius and minimus. Now, why isn't it maximus? We talked about maximus, didn't we? As extension of the hip, the major mover and extension of the hip, extension of the femur. Now we're talking about abduction. So a lateral movement that kicks in glute medius and minimus. And here are those pictures. Here's the max, but underneath the max is medius and minimus. And you see in this picture here of the glute muscles, you see the piriformis? Oh yeah, piriformis is going to get involved here too. But let's take another look. The movement of adduction. Oh, this is adduction, not abduction. So let me change gears here. Piriformis is also involved in AB, abduction. Now, we're going to change gears and go to adduction. You may see adduction at the gym in an adductor machine like this. You may see adduction with a cable or a TRX machine like this, but it is the movement of the leg adding to the midline of the body. Adding, adduction. Looks like I got my slides out of place there. Oh well. Wanted to talk about the piriformis anyhow in the TFL. So not to be confused with abduction, we're back to abduction. So that's moving the legs away from the midline of the body. Stay with me. Yup. So I wanted to talk about the piriformis as an abductor, abduction, and then also TFL. TFL is a muscle. It's a tensor fasciolata, TFL, and that also assists with abduction of the femur. So abduction at the hip joint, abduction of the femur. Okay, sorry for the out of sync slides there, but we're going to switch gears to adduction. So the thigh moves immediately towards the midline of the body. And these muscles that assist with abduction, this is ADD, adduction. Those muscles help to stabilize the hip as well. But let's take a look at those adductors, shall we? Love it. Thanks for your patience in the imperfection. So the beautiful thing about adductors is they're named adductor. Yeah, beautiful, right? So adductor longus, adductor brevis, adductor magnus, gracilis. Ooh, so it is sartorius that goes over two joints because gracilis is right here. I forgot. So gracilis is one of the adductors. Sartorius, S. Yeah, that's in the front of the leg, different muscle. Let's stick with our adductors. And here's another nice picture of the pectineus. A little tiny muscle up there. Got gracilis. And then our three adductors. All right. We'll definitely get to those questions at the end of class, but want to stay steady on these muscle groups. So brevis, longus, magnus, gracilis, pectineus, and yes, you can see the gracilis attaches to the tibial tuberosity. It's attaching to the tibia, and therefore it is crossing the knee. What other movements did the pectineus assist us with? Ooh, we saw this picture early on in our lesson. So what other movements? So we're talking about pectineus as an adductor, right? So it's an assisting there, but it also, what other movement did the pectineus assist us with? Uh-huh. John Roberts says flexion, and he would be right on. The flexion, yes. So flexion, it also assists us with flexion, little pectineus muscle there. Good job. Next movement. So we've covered both flexion and extension. We've covered adduction and abduction. We got two more movements to cover, and that is internal and external rotation. Let us look at medial rotation of the hip. So our little cartoon character here, internally rotating the femur. So I like this picture here a lot because that femur is internally rotating. Medial or internal rotation of the hip. Yes. And so what muscles are going to contribute, are going to be helpful? So it's bringing that knee medial. So if you turn that knee in, so if you turn the knee towards the medial aspect of the other knee. And I'm just going to see if there is a little question about this. So medial rotation, we go back to glute medius and minimus. So internal rotation, go ahead and bring your left knee, put your kneecap on the medial aspect of your knee. So on the inside, the medial aspect of your other knee, that is called internal rotation. So your toes are turning in, your heel is turning out. And so the kneecap of your left leg touches the medial aspect of your knee. So turning that in, medially rotated. That is done by the glute medius and minimus, and of course it's supported by the adductors, TFL, and a little bit of the hamstrings. Primary movers, though, you know I'm a big person on primary movers because we can make an argument for all sorts of little muscles helping out. But the primary movers, glute medius and minimus. Now, switching gears to lateral rotation. Medial rotation brings the kneecap towards the medial aspect of your knee. Lateral rotation brings your kneecap out laterally. So that lateral rotation, you can see here in the image, the femur itself is, that knee is moving laterally out. So if you take let's do the opposite movement on your left leg. Take the sole of your foot and put it on the medial malleolus. That brings you into lateral rotation. The most powerful muscle that's doing this is going to be your glute max. It's assisted, of course, by the piriformis, because you saw where that was located. Gracilis gets into the show, but we've got 6 deep lateral rotators. 6 deep lateral rotators. And that's what they're called, the 6 deep lateral rotators. I don't suggest you memorize all of them. You can if you're a good memorizer. But here's what they are. The obturator, the gemelli, and the quadratus femoris. Again, seeing them here will be enough because they're always listed together. They're called the 6 deep lateral rotators. Lateral rotators. Yeah, lateral rotation of the femur. And those occur in the posterior compartment and all around the hip joint. I don't think I put a picture of that in there. Oh, I did. Look at me. All right. Here's glute minimus. Okay, so let's see what we're looking at here. Right here's the iliac crest. We got this gemellus muscle right in here. And all the 6 deep lateral rotators. Aren't I nice to you, showing you them all? All right, minimus. So let's see. Okay, so the obturator internus and externus gemella. And those are all listed in here. Beautiful picture of the piriformis. Again, external rotation. Think about that now. Go ahead, put the sole of your left foot against your medial malleolus. That is external rotation. So quadratus femoris plays a role in the external rotation, but really what I want you to know is that glute max and piriformis are our major movers of those two in that movement. Yeah. So feel free to come back to this, pause it if you want to take a look at this more. All right, a little comic relief. We've been going through a little winter in some parts of the United States. Here's a little boy dropping a snowball to try and crush the top hat. Boing! Smacks him in the chin. And then one snowman saying to the other snowman who has the hole, she's carrying the baby snowman. And this male snowman says, "Oh, was it a C-section?" "Yes, it was a C-section." This is the lady answering. "Yes, it was a C-section. How did you know?" All right, take a breath. Go ahead, take a breath. That was a lot. Time to dissect some questions. You ready? Here are the rules. Rules. We have rules. Now, we have suggestions. If you would go ahead when you know the answer, some of these questions are going to be 3 answers. Others are going to be 4 answers. Because the MBLEx right now is about 80% 3 answers. So we're busy updating our practice exam. We're busy updating our slides. And so when you know your answer, the answer you would like, go ahead and put it in the chat. But wait, please wait to send your answer. We have visually impaired learners. We have auditory impaired learners. We're going to give this just a moment. You have a full 1 minute to answer a question on the MBLEx. Yeah, I won't make you wait 1 minute, but you have a full minute to answer. So go ahead, put your answer, the best answer in the chat. I'll say 3, 2, 1, go. Boom. And then we'll get it. And away we go. What is the major muscle mover of abduction? Is it A, tensor fasciae lata, B, iliotibial band, or C, glute medius? Now, I want you to think about this What is plausible? When Ruth Werner comes and does dissecting the questions with us, she asks us, what's plausible? Now, I'll help you out here. What is the major muscle mover? Okay, so I didn't give you the answers yet, sorry. A, tensor fasciae lata, B, iliotibial band, C, glute medius. Is the iliotibial band a muscle? It is not. So it can't be the major muscle mover, right? Mm-hmm. Put your answers in the chat. Go ahead, put your answers in the chat. Hold on, hold on. Okay, go ahead. Put your answers in. Go ahead, go, go, go. Yep. And think about the size of these two muscles, okay? That's also going to give you a clue on the size of these two muscles. Carol, nailed it. Hey, Carol, I didn't see that you snuck in here. Hi. John Robert, yay. Johnny, yay. Znap, you got it. Raven and Tracy, Shereen. Oh, none of you guys were fooled. Alicia, yes. Catherine, hi. Lek, nice. Alexis, good. Excellent. Boom. Yes, it is letter C. Glute medius. Remember, abduction is away from the midline of the body. Glute medius is the major muscle mover there. Next question. What muscles move the hip into extension? Ooh, don't you hate these questions when you get them on your practice exam? Oh, I have to know all these muscles? Yes, you do. All right. What muscles move the hip into extension? Think about, please, first. What is extension? Yes, think about that movement in your mind. Be careful. About 50% of you are thinking flexion right now. So, hip into extension. A, glute maximus and the hamstring group. B, rectus femoris, vastus lateralis, vastus medialis, vastus intermedius. C, biceps brachii, semitendinosus, semimembranosus. D, gluteus medius, gluteus minimus, assisted by the piriformis and tensor fasciae lata. Guys, this is actually an easy question. Okay, there's one you can eliminate right away. Can you look at letter C and see something wrong with that? What do you see that's wrong with letter C? Probably not going to be this obvious on the MBLEx, but it might be. We're going to get rid of letter C because biceps brachii. Yeah, biceps brachii. That's not in the leg. All right, 3, 2, 1, go. Hit it. Tell me what you think. Tell me what you think. Where are we going? Where are we going? Tracy Leck, yay. Good. Catherine, nice. John, Shanique, yes. Migdalia, yes. Hi, Migdalia. Didn't see you sneak in. Snap, yep. Alicia, Raven. Shireen, yup. Yup, yup. Alexis, got it. Nice. Best answer. Boom. A. Glute max and the hamstring group. Okay, so we got rid of letter C because of biceps brachii, right? We got rid of letter B because what is letter B listing? Ladies and gents, what is letter B listing? What are those? Rectus, vastus, vastus, vastus. There are 4 of them. Yes. Raven, the quads. Tracy, the quads. That's not moving the hip into extension, right? Good. Yes, Shireen, the quads, exactly. All right. That means that if it's not the biceps brachii and it's not the quads, then it's got to be either A or D. And I like your odds when it's 50-50. I'll take it. Glute max is the one that brings the leg into extension. Glute medius is into abduction. So like this. Next question. Ooh, I did not go over this. Clearly, I said it, but I didn't go over it. All right, the correct name of the ASIS is what? A, the anterior inferior iliac spine. B, the anterior sacroiliac spine. Or C, the anterior superior iliac spine. Mm-hmm. Mm-hmm. 3, 2, 1, go. What do you think it is? ASIS. Ooh, Tracy, yeah. John Robert got it. Lek, Migdalia, good. Shireen, Alexis, good. Excellent. Catherine, Jonique, Alicia, Zenap, yeah. Robin, Raven, Carol, nailed it. Good. The correct name of the ASIS is not the anterior inferior, but the anterior superior. Yes, ASIS, anterior superior iliac spine. High five. That was good. Nice one. Okay, next question. Ready? Ooh, here we go. So the ASIS, and if they are asking you on the MBLEx for a specific point, like ASIS, it's that point that is right in the front. So if you put your fingertips, your first and second finger on your hips, and this area goes on your iliac spine. Where your fingers are touching in the front is the point that is the ASIS, but it does stand for the anterior superior iliac spine. Good work. What is what is the primary muscle involved with the first step of walking? Is it rectus femoris, glute max, rectus abdominis, ilipsoas? What is the primary muscle involved with the first step of walking? Go ahead. 3, 2, 1, go. Let's do it. Woo! Trace and Leck. Robin Carroll, Chanique and Raven, yes. Zenap and Alexis. Catherine and Shreen, good. Good, good, good. It is not the glute maximus, but it is letter D, the ellipsoas. Nice. Yay, you're super clear on the first, what initiates the first step of walking. It's elusive, right? Because your brain wants to say rectus abdominis. It's that really primary, strong, dominant ellipsoas. Good work. Ooh, a long one. Okay. When performing the Thomas test, what indicates a positive test and what muscle is most likely tight? Okay. So we have to think about the Thomas test. So what are we doing? Remember we went over the Thomas test today. It's the one where you're laying on the table, right? Think about how your client is laying on the table, I should say. A, if the Thomas test is positive, then A, when walking, the hips are unstable, the quadratus lumborum and the gluteals are most likely tight. Or letter B, when the Thomas test is positive, when they're laying on the massage table, the femur rises, rectus femoris is most likely tight. Or is the truest statement letter C? When laying on the massage table, the femur is flush to the table, indicating the gluteals are most likely tight. All right, go ahead. 3, 2, 1, go. Put your answer in there. Which is true? Ooh, Tracy and Migdalia, yeah. Raven and John Robert, yes. Robin and Alexis, good, Alec. Very good. Zenap, you got it. You got it. Best answer. Letter B. When laying on the massage table, when laying on the massage table, if the femur rises, rectus femoris, which is one of our hip flexors, is most likely tight. Yes. Now, letter C is true. When laying on the massage table, the femur is flush to the table. It's indicating glutes are tight. So a negative test is when the femur is flush to the table. A positive test is when the femur rises. Good. Next question. What best describes the superior attachment point of the hamstring group? Ooh, ready for this one? What best describes the superior attachment point of the hamstring group? Where are we? Where are we? Okay. A, the proximal end of the femur. B, the bottom of the ilium, the sit bones. C, the bottom of the ischium, the sit bones. D, the distal end of the femur. What best describes the superior attachment point of the hamstring group? We know we can get rid of one of these answers right away, right? Where are we? So what best describes the superior? So are we at the top or the bottom? The superior attachment point of the hamstring. We didn't say origin, we didn't say insertion. We said the superior attachment point. So can we get rid of the distal end of the femur? We can, right? Yeah. Okay. 3, 2, 1, go. Tell me, where are we? Tell me, tell me, tell me, tell me. Migdalia, yes. Ooh, Tracy and Catherine, good. Raven, Leck, okay. Good, good. Nice, nice work. Where do the hamstrings attach, my lovelies? Where do they attach? What's the common name of where the hamstring group attaches? The sit bones, right? Yeah. Best answer. Bottom of the ischium. Remember, S, sit, ischium. So the bottom of the ischium, the sit bones. Yes. Now, I can understand why you might think that the hamstrings attach to the proximal end of the femur, but they do not. They attach to the ischial tuberosity. Ischial tuberosity. Yup. Okay, next question. Oh, here it is, the ischium. Right? Those are the sit bones. Remember, moving the fleshy part of your butt away, you can touch your sit bones. It's where your hamstrings attach. What is the os coxae? Okay, it's been a minute since we talked about this. What is the os coxae? Do you remember? I think you do. A, the 4 bones that make up the pelvic girdle. B, the bottom of the sacrum. C, the biological name of the hip joint. Or D, the 3 bones that make up the pelvic girdle. I'm just going to go for it. 3, 2, 1, go. Yeah, tell me. Let's see what we got. Ooh, we got a split decision here. Okay, good. We got Tracy and Leck. Yep. John, Robert, and Alicia. Good. Raven, Alexis. Good. Zeynep and Shireen. Yes. Shanique. Yes. All right. So it's not the bottom of the sacrum, right? Because that's the coccyx. Best answer coming up in a minute. Catherine. Yes. Best answer. Boom. The 3 bones that make up the pelvic girdle. Yes. So there's not 4 bones. The biological name of the hip joint is the coxal joint. Yeah. Okay. The 3 bones that make up the pelvic girdle. Yep. I think that was our last question. Yay! That's a wrap for today. Yes, nice work. And got a couple of little announcements here at the end of our session today. And that is, if you need email, if you have a question, you can direct message. That's the easiest way to get us and the fastest. But we've got a phone, an email. the website. I want to let you know that the next class for next week on Thursday at noon is client assessment. That is going to be the formulation of your treatment session, the formulation of your treatment session. And then mark your calendars, because March 30th, so in about a month, registration isn't even open yet, so you haven't missed anything. But on March 30th is our business roundtable, and you guys are invited. Normally, it's only for alumni support, the people who are building a solid foundation for their practice. They've already passed the MBLEx, and this topic you are going to love. It is back to basics, so it's like those fundamentals that you need to be successful as you launch your massage career. So this is everything about rebooking, about how to screen clients before you actually make them an appointment. So if they're not somebody you know, uh, the dialogue to have on that massage table, how to assess a health intake sheet. I mentioned rebooking, how to follow up. Lots of good things. Lots of good things. And so mark your calendars. That's March 30th. It's a Monday, and that's going to be at noon, Monday at noon Eastern. So here we all are. And I am going to wrap up our session for today by reminding you my name is Jody Scholes. I am happy to be your instructor for the MBLEx review course. Woo-hoo! You did it. High five. High five. I'm going to hang out with this gang for a little while longer and answer some individual questions, but I want to say thank you for making this time to study. Because you know what? Nobody finds the time to study. We make the time to study. So thanks so much. And I look forward to seeing you again next week. Yeah, see you soon.